Hello to my Instagram family and friends. My name is Julie Hirschberg. I am the owner and founder of Re+active Physical Therapy and Wellness in the Los Angeles area, and joining you live to once again chat about some of my favorite topics. So I'm going to actually move this here and I'm going to bring up a couple of figures. So I'm hoping I can change this around as we go. I want to introduce you to this paper. It's my new favorite. It's called Integrated Therapy for Functional Movement Disorders, Time for Change. I think it's long overdue that it's time for a change in functional movement disorders in the kind of traditional medical world, to be honest. So this is a really wonderful paper. It's free, full text. If you're part of our newsletter, I send out all of our videos and resources and links to all of this in the newsletter. You can sign up in our newsletter in our link in the bio. So I'll send this out if you want access to it. It's a nice, easy little read too. So I wanted to highlight what it means for integrated therapy, what this article talks about, the outcomes that they see with integrated therapy for functional movement disorders. And I honestly am going to quote some pieces of this paper because it is so good. So one of the first pieces that I'm going to talk about, and I'm going to see if I can... There we go. I'm back. Okay. I want to share this model here, and I actually have a picture of it. So I'm getting kind of crazy here, sharing a different model. It's kind of small, but I think you can get the general idea. I really love this as an explanation of different ways that a person with a functional movement disorder might be seen in the medical world, and the downfall of some of the ways, quite honestly, in a very traditional world. And, you know, especially years ago, when somebody had a functional movement disorder, they might be seen by a neurologist or a physician and just directly sent to psychiatry, basically saying this is a psychiatric disorder only. The movements that you're experiencing, the sensory problem, the fatigue, pain, it's not real, it's not physical, it's in your head, and go see a psychiatrist. So that is the first picture there in the blue bubble, psychiatry. What I really love that these authors did is they highlighted, well, your recovery potential might be limited here. There might be barriers to engage with a psychiatrist. There might not be a clear target because oftentimes there is not a psychiatric disorder. So that is a big limitation of a pure psychiatry model. And the second bubble from this article is a just psychotherapy version of things. So I'm getting a knock on my door, of course, during live. So whoever it is going to be joining me. Hello, I'm doing a live video. Hi. You can say hello to everybody. Nice to see you. My daughter just got home. Hello to Annalyn. So talking to psychotherapy, the second bubble, the yellow, is psychotherapy. So this is another common model in functional movement disorders, just a referral to psychotherapy. Again, the authors note this recovery can be limited, and they say there could be ongoing perpetuating factors, and it can be hard to find a specialist who knows functional movement disorders. Now, the third model that they talk about here, I think also is a very common one, is that the neurologist or the physician actually refers to psychiatry or psychology and PT at the same time. So parallel referrals, those people are working maybe even at the same time in parallel, but not talking to each other. I've definitely lived in this world with many of the people that I've worked with functional movement disorders, and the difficulty, the challenge here is, just as the authors state, the recovery can be limited by a lack of coordinated care and discussion. I find that really, really frustrating. The other thing that can really happen is the messaging is not consistent. And this is something I value a lot. This is why we have started our programs we've actually been doing this for the last 6 years, but just doing it a lot more, is a much more integrated therapy model. So in this last bubble, they talk about integrated neurology, psychiatry, and physical therapy. That's the outcomes that they talk about in the paper are actually very specific to a program that they did where they had all three in one location working with somebody. And here they show an enhanced ability to have recovery because there's communication, there's collaboration, there's a common message and common understanding, and it's more efficient. The other thing that I really love is that last bullet point. I don't know if you can read it. It's teeny tiny at the bottom. They say that a huge piece of this is modeling of the brain, mind, body integration by the whole treatment team, because literally they are working together. This is what I love about doing an interdisciplinary intensive with people, is to truly be able to address things holistically, mind, brain, body, all at the same time. Now, of course, I would go beyond the neurology, psychiatry, PT, right? So I would go neurology, psychology, and we typically work with a neuropsychologist or a psychologist, and PT and OT, as well as members of a health and wellness team, yoga therapy, physical personal trainers, an exercise class, maybe a group setting. So I would expand that integrated care just beyond those three disciplines. And I think we would continue to find really positive results. So this love this article, love this particular diagram from the article. I'm gonna, take it off here for a second. I feel so fancy that I'm able to do that. And put it up and put it down. I've never done that before. I want to share a few things from this article too. And this is why, if you work with people with FMD, if you're working in an integrated group, share this article. If you're not in an integrated group, share this article. It has so many great little nuggets in it. And, one of the things that I'm going to point out a few things. So one, and I'll read it to you. They say functional symptoms remain underdiagnosed. This is the second most common diagnosis presenting to a neurology office. So they remain underdiagnosed and relatively unknown to the general public, despite being the second most common. The patient experience, this is what I hear over and over again. The patient experience with healthcare providers is frequently one of invalidation and incomplete explanation of their symptoms. Drives me batty. I've been there. I've been in a doctor's office feeling invalidated and not having a complete explanation. And to have that happen multiple times with many different doctors, it is just so painful and frustrating. So this, again, is part of their argument why having an integrated team. Another thing, they highlight a lot of the research here. Patients receiving that joint integrated care reported good outcomes at 3 years. So I've actually had wonderful patients reach out to me and go, what are the outcomes? What can I expect for people? And when people have good integrated care, they have much better outcomes, even up to 3 years later. And in one particular study that they highlighted, looking at people long-term with this integrated care, they compared them to people who had standard care. 70% of the group in standard care was no longer working after 3 years. So they had to quit work. 20% of people in the integrated care were no longer working. That's a big differential. And I think that's pretty exciting because I think a lot of people want to return to work. So that was one piece I wanted to share. I shared with you the diagram. Love this diagram. By the way, you can download this free full text article. And if you're on our newsletter, I'll send it out on Friday. There were a couple other pieces that I really, really love. And I'm going to quote again here. So they argue that a truly integrated model challenges the dualistic notion that the mind and brain are separate and instead attempts to help patients appreciate that their movement, their sensory processing, their cognition, and emotions are intimately connected. This is like why I get so passionate about functional movement disorders, because it truly brings that holistic thought, the whole person. It's not dualistic. It's not brain and body. It's not mind and body. It is all together, and they influence each other. If you've been with me before, you know I talk about this pie chart, and literally they like highlighted each part of the pie chart here. Sensory, motor, emotional, all interconnected. And it takes a team. It takes a village to figure that out and put it back together. So, again, maybe I love this article because they are speaking my love language about FMD, but there's so many great little nuggets in here. If you're new to FMD, I highly recommend it. Again, you can join our newsletter. I'll send everything out on Friday, but this is your free full text article. It's called Integrated Therapy for Functional Movement Disorders, Time for a Change. Sarah Lidstone and colleagues. It was from 2019, and it is from the lovely area of Toronto, Canada. A lot of great things in Canada and the UK and the functional movement disorders world. So I highly recommend it. And I've got something exciting to tell you. So I put out over this weekend or early this week, we were thinking about doing a functional movement disorder webinar. As you know, this is like my passion area. This is a passion area of Re+active. And I put out there lots of questions like, would you like this? Pretty much everybody said yes. When would you like it? Most people said they would like it on a Saturday. What would you like me to talk about? And I got so many great suggestions. So I pretty much could not say no. We are going to host a free functional movement disorder webinar. So if you're here and you are interested, like, drop me a little heart in the comment, drop me a little brain, but also go into our link in our bio. I just posted it, free functional movement disorder webinar. This is for healthcare professionals who just want to have it made simple. I think functional movement disorder can feel very mysterious, can feel very overwhelming. All right, Veronique, I got a little brain in there. I got a little heart from Courtney. Yay. I'm so glad. You'll have to come to our webinar. It can be so overwhelming. It could be complex. It could be difficult to know where to start. It could be difficult to know where to go next. And yay, Sherry! Sherry's my partner in crime on the Chicago side of things. Yes, free webinar. So we are going to do functional movement disorders made simple. One of my favorite things is to look at the complexity of the brain, look at everything that's happening, synthesize it, and then simplify it so it's easy to understand, and most importantly, so that we can make a difference for people, that we can undo some of the trauma that has occurred in the medical system where a person's been invalidated and has been told it's all in their head. So this is our functional movement disorders webinar. So hot off the press, we're putting it together right now because people really want to learn this. And we're going to do it on Saturday, September 18th. We're going to do it at 9 a.m. to 10:30. So we're going to go an hour and a half, because whenever I give myself an hour, I always go over, and we've got lots to share. So, free webinar, September 18th, Functional Movement Disorders Made Simple for Healthcare Professionals. And if you can't join us live, you can catch the recording. We are going to go through all of those things that you've seen me talk about on here, our pie chart, but actually show this is how we use it and this is how we do it, and make it very, very simple. So that literally you can be in general practice, you can be in outpatient orthopedics, you could be in pediatrics, you could be a speech therapist. Somebody said include speech therapists. So speech therapy, occupational therapy, physical therapy, we can make it very simple and have ways of understanding and applying that could apply to any case. Functional weakness, breathing difficulties, speech, singing. So we're going to talk about all of it. I'm so excited. We're literally just putting, like, I literally just hit the button, like, we're going to do this. So September 18th, I hope you'll join us. Free webinar, Functional Movement Disorders Made Simple for the PT, the OT, the speech therapist. I know actually I've had a few doctors reach out to me as well. If you're really interested in seeing the rehab approach for functional movement disorders, I hope you'll join us for that webinar. Again, it's September 18th at 9 in the morning, but you can also catch the recording. I'm on Pacific time, so that's 9 a.m. Pacific time. So anyway, thank you so much for joining me on my little passion trip of functional movement disorders. This is what I love, and I really love getting the word out there for people. So thanks for joining me on that. I hope to see you in the webinar. Again, there's a link in the bio, and you can join me as well on Friday for my Facebook Live on our Facebook page. We're going to dive in. On Fridays, we get to go a little bit deeper. We're going to dive in a little bit deeper to some of the outcomes and some of the changes that occurred in people in this study. They actually talked through a few cases, and it was really inspiring. So we're going to talk about that on Friday on our Facebook page at 12:30 Pacific time as well. So I'll see you there. Thanks so much and have a great evening.